Hello, my name is Sean Watkins, and I am a nursing student at UMass Amherst. In this video, I will be discussing a situation I faced in my Nursing Fundamentals clinical rotation. I will reflect on this experience and how I communicated with a patient experiencing emotional distress. I will then discuss how my therapeutic communication skills have improved through my psychiatric nursing experience, and how my new knowledge would change my patient interaction if I were able to experience it again. In order to maintain the patient's privacy, their real name will not be used in this video. We will refer to the patient as Juan. Juan was not the patient I was assigned to during the day. However, he shared a room with the patient I was working with. When I was assisting my patient, Juan called to me from behind the curtain that divided the room. He asked me if he could have some more water. After checking his orders to ensure he was able to have more water, I brought him back a cup. I asked if there was anything else I could do for him. He told me he wanted badly to leave the hospital because his son had recently passed away and he needed to be there for his family. I immediately struggled to respond and felt as if the room was extremely awkward, and I began apologizing profusely, not even thinking about the words coming out of my mouth. In my awkward and panicked response, what I asked next still makes me red in the face when I think about it. I asked how his son passed away. I knew when the words left my mouth, I was treading on a sensitive subject. Juan was extremely kind and did not hesitate to answer my question. Despite his response, I knew I could have approached the situation better. We talked for some short time about his family and why he has to stay in the hospital. He was happy to talk about his daughters and wife and understood he needed medical help, but he was still visibly distressed. I didn't feel as if there was any more I could say to help. He thanked me for talking with him and again for getting him water, but I felt that I could have done better. I was uncomfortable in the situation, and I felt I lacked the ability to comfort and help someone in that moment. It was in the first psychiatric nursing class, where Professor Green and Professor Lowe simulated therapeutic communication, that I began to see how intricate yet simple it is to communicate effectively and constructively. I experienced genuine wonderment at how calm and comfortable Professor Lowe was during the conversation, especially when sitting in silence. As other therapeutic communication techniques were used, such as reflecting and offering self, I wanted to gain the skills and confidence to do the same. Throughout the semester, we learned therapeutic communication and practiced these skills in clinical. It became clear to me how important it is to slow down the conversation. Not every statement by the patient needs a follow-up question, or even a response. It is more important to let the patient think and to let them speak than to fill the silence with a meaningless question. Reflecting a patient's statement back to them lets them know you have heard what they have said and gives them an opportunity to elaborate further if they'd like. Acknowledging the patient's feelings and actively listening lets the patient know you care and you are hearing them, even if you don't have a response. After learning the skills, I will utilize them in my future practice. If I could go back in time and speak with Juan again, I would use the skills I've developed in clinical. When Juan informed me that his son had passed away and he wanted to leave the hospital to be with his family, I would have begun by offering myself. I would tell Juan that I can see how difficult it must be to be stuck in the hospital during this time, and that I would be there for him if he wanted to talk about it. I would reflect Juan's statements by making statements such as, "So you're feeling distressed by being here because you need to be home to support your family," encouraging Juan to elaborate on how his hospital stay is affecting his situation. I would listen and give the opportunity to speak before projecting my own thoughts, remaining silent before saying something that might be counterintuitive or deteriorate my relationship with Juan. I would help him to come to the understanding that his family needs him healthy, and in order for him to be as strong as possible for his family in this time, he needs to recover. I would ask him what he knows about his stay at the hospital and what he knows about his surgery. My goal would be to help Juan be more comfortable during his stay, to feel encouraged to regain his health, and to ease the distress he was feeling, so that he could return healthy to his family as soon as possible. The new knowledge I gained this semester did not come to me in one specific moment, but has grown over the semester. Therapeutic communication skills are what I value most from my learning. I will continue to build on these skills and work towards being the best support I can be for my patients. In my future interactions, I can help promote more positive outcomes and build stronger relationships by using therapeutic communication.